Welcome to this month's AGU AGI Heads and Chairs webinar. A couple quick introductions. Online with us, Pranoti Asher, who's the Assistant Director for Grants and Education Programs at AGU, Eva Kostiu, who is the Program Manager for AGU's Bridge Program, myself, Christopher Keene, I'm the Director of Geoscience Profession and Higher Education at AGI, as well as Leila Gonzalez, who is our Technical Specialist here at AGI as well. So today's webinar, I'm real excited about this. It's mental health on college campuses and scientific institutions. Are we in a crisis or in the midst of a transformation? Eric Backo is coming to us from the United States Naval Academy. And I had the opportunity to meet Eric and hear his discussion on this topic a couple months ago. And I think it's outstanding and one that is critical and should shed a lot of light for folks about their students and the challenges that are going on in our community. So I think with that, Eric, if you want to start sharing, I will stop.
Sure. I will share. So let me go ahead and get things started. As Chris had mentioned, I had given this talk or a version of it several months back, and so I'm just going to continue that conversation. So that's a picture of me. If you guys can't see, that's me at the U.S. Naval Academy. I teach here at the Naval Academy the psychology classes, and I also provide services, psychological services at the Midshipman Development Center, which is like our counseling center, as well as provide evaluations over at our health clinic. So I'm pretty steeped in mental health service delivery, as well as in the education side of the house and the teaching aspects of the institution here. My previous job before coming here, I worked at the United States Marine Corps headquarters, which allowed me to see at a large organizational level the impact of sort of psychological or behavioral health type concerns that are affecting at multiple levels, at big service levels, so U.S. Marine Corps, U.S. Navy, Department of Defense level. I'm operating now in an academic setting, and I also treat people directly clinically. So I have kind of a unique perspective on this particular phenomenon. And I've recently been engaged in some research on looking at some of the behavioral health concerns, specifically in the area of ostracism and isolation, social isolation, and its negative psychological impact on the readiness of our forces. And so it all kind of comes together. Now, my background is that I come from a pretty varied background before I even came into the Navy. Prior to coming in the Navy, I graduated from Florida State, and I used to work in a prison. I was a prison psychologist, and I had to do a lot of evaluations of people there in those types of settings, which oddly enough prepared me to do a lot of the heavy work in the Navy and Marine Corps when dealing with problematic behaviors. So that was a pretty good experience. I got a second specialty in pharmacology, so I also have expertise in providing medications for people suffering from mental health illnesses. And that's a picture there where I got my training at the University of Hawaii at Tripler Medical Center. And I've applied a lot of this in the fleet. So that's me on the deck of a U.S. aircraft carrier. That's the Theodore Roosevelt, where I was providing direct services to sailors, fighter pilots and the like, while underway and during the Gulf Wars. I also was deployed with the Marines and the Special Forces in some of our intervention work in Africa and in Yemen. But perhaps my most cherished background memory is I used to be the captain of a breakdance team back in the early 90s. So if that's of interest to you, that's something I also have a background or interest in. All right, so moving on. Real quick question. Chris, do you recognize what you're seeing there?
Sure, it's periodic table.
There it is, right. Now, Chris, I'm gonna dip into your acumen, and can you tell me, this is iron, right? Right. That's the element iron. How about this one? Are you familiar with it?
Lithium.
Very good. Now, lithium is pretty useful for psychologists and psychiatrists in helping with mood stabilization and the like. And so it's a very useful element for us. There's obviously its atomic mass and its number. How about this one, Chris? Are you familiar with that?
Oh, I'd have to dig deep in the brains, but I don't think it's an actual element.
Well, there you go. And you know why, Chris? You had to dig in for that because that's why you asked me to participate in today's talk, because it's the human element. All right. And I wanted to talk a little bit about that. And its atomic number and mass is infinite. And the reason why I present it to you this way is because one of the things I've experienced in giving these types of talks with predominantly folks in the STEM world is that understanding humans is sort of implied when you go to work, but really having an in-depth understanding of what is it that humans bring to the equation in the workplace, particularly the challenges that working with humans presents in the workplace. And I'm gonna postulate for you and submit this proposed thought to you, and that is beyond what you might know in your specific areas of specialty, knowing about what is influencing not only humans where you work, but what's happening in the larger society that might be influencing what you're seeing in your workplace, whether that's in your academic setting, in your agency, or in your lab, or whatever level you might be operating on. And so that's sort of the segue into my topic here, where I'm going to be looking at and talking about what we currently are seeing across college campuses around the country and in workplaces. And the question that's going to sort of carry throughout this talk is, are we really in a crisis? In other words, a negative connotation to the word crisis, or is this actually an opportunity and a time for transformation? I kind of tend to have a positive skew towards things. So I'm going to make the argument that we actually perhaps are facing a unique period in the history of our country in transforming not only the classroom, but also understanding the workplace. Now, I graduated from Florida State with my doctorate in 1997, many moons ago. And they issue these for all the alumni. They issue these blocks, these bricks with your name on it, the year you graduated. And I thought that was kind of interesting because I didn't know if they're trying to imply that we're dumb as bricks or something like that. But there's my brick, and that's something that I'm rather proud of. Now, I came back several years later. My oldest boy, Johnny, just graduated from Florida State, my alma mater, and I noticed when I went back to campus how different the place was. Part of what struck me was how not only the buildings changed, the look and the feel of the campus changed, but also it seemed when I was talking to all the young people in his graduating class that I met that day, they had a distinctly different attitude towards things. So what I realized was, even though the university was still there, so much of it had changed in ways that I could only detect indirectly. And I also realized too that I had changed. Now, this brings up my favorite philosopher, Heracles, who famously wrote about this idea that no man ever steps into the same river twice, for it's not the same river and he's not the same man. Now, I say that because what I began to realize in my experience back when I went back to my alma mater was that there was a transformation going on in both the institution, but also I had gone through changes over the last 27 years. Those changes in me were interacting with the changes that were occurring in the culture and the environment of the institution that I had left all those many years ago. And I suspect that this is something that's playing itself out in many other places. That is, we're many years removed from our formal education in whatever pursuit we had. Mine was in clinical psychology, but we experienced many things along the way, and also there was changes that occurred along the way. Now, this talk today, this is the objectives. I want to be able to clarify this idea that there is not so much a crisis as there's a transformation occurring, and because I'm going to apply a growth-oriented lens to my discussion. I'm going to talk to you guys about how to detect, connect, and direct students or young professionals or people in your workplaces towards resources and services, and how to go about doing that. And I'm going to talk about some implications using a sort of a generational transformation approach, and the intent is to help promote sort of growth as an organization and you as individuals during the course of this talk. And this is not an annual training requirement. It's meant to provoke thought. So I really want you to put your thinking caps on and raise questions if you have them. So keep an open mind and a curious ear. And I'll take questions throughout during planned breaks in the presentation and also a discussion at the end there. Now, today's roadmap will have me walking through the data, the studies that have been substantiating this idea that student mental health has been deteriorating across the nation, and that it's affecting not only students in campuses but also early career scientists, as I'm beginning to realize as I look at this more closely, and that we are indeed, in my opinion, going through a transformation, and there are things you can do to cope and deal with it. A Tale of Two Kingdoms. Now, at the United States Marine Corps, they have a really great program in indoctrinating civilians into their world. They call it boot camp. And one of the schools that they have, the School of Infantry, is where they sort of take the basic training that the Marines learn, and they specialize them in hand-to-hand combat and fighting type skills. And that's at the School of Infantry. And what was interesting about the School of Infantry was, for the first time in United States Marine Corps history, we had, I think, a dozen or so Marine candidates who they dropped out. They dropped out like within 2 weeks of graduation, and it stunned the faculty there, the trainers there, because no one ever really quits 2 weeks before graduation. And when they did the exit interviews, the mortality and morbidity type reviews of why these particular students dropped out, their common response was something on the lines of like, I didn't join the Marine Corps to be a Marine. I wanted something more, and I gave it time to sort of play itself out, but I just don't think that this is the right place for me. And so, in a sense, they were for the first time articulating this notion that being a Marine was secondary in the minds of these young people to being something bigger than that. But again, they were 2 weeks away from graduating, and by therefore several months before they even actually were performing the job of being a real Marine. And I'm going to leave that with you to think about for a second, because the same thing happened here at the Naval Academy. We're having a lot of people really reconsidering their commitment to finishing their time here at the Academy. And really, really rethinking their commitment to the idea that after graduating from here, that they go on to serve an additional 5 years in the Navy or the Marine Corps. Again, these things are very unique in the history of both of these two institutions. And I'm going to try to shed some light on maybe why that is. Now, I'm going to ask, and Jim, if you can help me out here, because I can't quite see who might be responding in the chat. But I'm going to pose this question. It's a scenario. Your student, let's call him Jim. He doesn't turn in assignments, maybe this is a classroom setting, or complete projects on time. Initially, he presents as a motivated, articulate person in group meetings and very conscientious. He has great potential, but he now seems to be blowing it all off. He's become moody, unfocused, disheveled, and you even think he smells of alcohol on his breath. So you decide to meet with him. Now, how would you and your institution deal with the Jims of the world? Has anyone ever encountered this type of a problem, and what are people doing about it?
Feel free to raise your hand if you'd like to unmute and talk, or post in the Q&A, and we can do it. Nothing so far.
Okay, but maybe just have that out there to think about for a second, because I want to propose to you.
We do have one. Okay, David, you can go ahead and unmute.
Yeah, hi. So in my experience, what my institution would do in a case like this is in advance have advised faculty to submit a student concern form to the university's case manager, and move this from a faculty concern to a mental health concern.
Yes. Okay, and I'm sure other institutions have similar procedures. And one of the things about this particular scenario is that we see this also, or at least we're seeing at least on the military side, we see this also happening in the workplace. Highly motivated individuals coming on board, newly assigned folks, but they seem to be presenting in larger numbers with these kinds of obviously troubling signs. Now, you can replace, the idea of students with an early career professional or a coworker, but I'm seeing a lot more of these kinds of scenarios being brought to my attention here at our institution, but also in other places where I've been in the last couple of years. Now, APA released a study last April, so it was almost a year ago, that began this discussion across all mental health providers, that the student mental health crisis across all the campuses are really getting to almost epidemic proportions. And part of what they're seeing is that, perhaps due to COVID, that they're facing surges in demands for mental health type services, and that those services have been far outpaced by the demand signal for them. And that by every metric, most of these academic institutions are looking at that they're seeing that mental health appears to be worsening, and that these higher caseloads, in the opinion of many of the mental health directors at the counseling centers, are saying, in a sense, I don't think we can staff our way out of this problem because they're coming in such large numbers, which necessitates then a discussion about how can we engage faculty or maybe other students or other folks on the campus to be involved in the mental health wellness, if you will, of the student population. Because again, the counseling centers we can't staff them with enough people to meet the demand. And I kind of make this analogy akin to what's being faced. A number of decades ago, there was an increase in the general American population in heart disease, hypertension, and all these other kinds of like heart-related conditions were really ballooning into sort of epic proportions. And the solution could not be hire more or make more cardiologists. They needed to look at this as a challenge up and down the entire strata of society, and so engaging nutritionists and other specialists who aren't necessarily directly related to the problem of heart conditions, but have a contributing influence on the trajectory of heart disease. Same thing with mental health. You don't have to be a psychiatrist or a psychologist to begin to address this growing need. Now, just recently, I believe it was last month, the Centers for Disease Control pushed out a study on mental health in adolescents, and they're finding similar disturbing trends. One of the things that was particularly disturbing was they found that nearly a third of adolescent females had reported having plans at some point in the last year of taking their own life, a plan for doing so. That should be concernful. As a parent of 5 children, if that's 1 out of every 3, teenage girls have had thoughts of dying by their own hands, and even went as far as to have a plan for it, that's concernful. So when I think about that, it really begs this question of like, well, what's going on? Is it that these kids are experiencing more mental illness, or are they more comfortable now in reporting what they're experiencing versus perhaps maybe a couple of decades ago, they might not have come forward with such revelations about their internal world? Are we seeing people now being responsive to this whole notion of seeking mental health? And more importantly, is that a generational thing? Are we starting to see a transformation in attitudes when we look at this younger generation being more and more willing to approach their adult supervisors or their adult minders that they're having a hard time, whereas maybe in the past they might not have? Is this a transformation in attitudes? Now, I'm going to talk about that for just a second or two here. The idea of generational differences in this transition. Now, this is from the Census Bureau and put together by the Pew Research Center. But as you can see here, it kind of lays across from left to right the various generations. Gen Z is in red. The light colored blue there is millennials. Gen Xers, my beloved generation, there is in the dark blue. And then as you move further to the right, you have the gray, which is the baby boomers, the silent generation, and the greatest generation folks. As you can see, obviously, those folks in the older age groups, the silent generation and the greatest generations, are proportionally becoming a smaller and smaller part of our population. But you can see the Gen Xers and the baby boomers are also beginning to decline, but that the vast majority of the people that are in leadership positions, that are in faculty jobs right now, are constituted by a few baby boomers, but likely Gen Xers and early some of the older millennials. And as you can see there, the vast majority of the workforce and the student population in the next 5 years or so is going to be predominantly Gen Zers. And what does that mean? Now, I'm going to show this quick video clip here on a phenomenon known as the quarter century crisis. And I'm going to go ahead and play it now. And I want you to sort of think about the message that's being conveyed in this particular clip. What the young adult was describing there was this experience that's going on throughout the country. This idea of these 20-somethings, early 20s, experiencing challenges as they emerge from their childhood identity of being like mom and dad's kid going to college, and then having to go into the world after graduation and finding work. And what she's alluding to in this particular video clip is that they're all struggling with the challenges of adulthood, because partly they were experiencing a confusing mix of, I have all these options and all these potentials, but I'm not sure if I'm ready at this point to sort of pursue all those options. Now, the quarter life crisis that's alluded to here gets at what we're seeing in young adults. Many of these young adults are leaving college with huge debts. Many of them are finding it hard to get entry-level work that would allow them to begin to pay down some of those debts meaningfully. And so many of them have moved back into their homes with their parents, with the idea of perhaps saving money so that they can potentially go out and land good work and eventually begin paying down those debts. And as we saw during the COVID crisis, there was a deferment for the payment of some of these debts because it was, we weren't allowed to kind of return to the workplace. But that just protracted this period. Now we have 25, 26, 27-year-olds who are emerging from, their sort of hibernation status and trying to look for work all at the same time and finding challenges in doing so. And what the emerging adulthood idea, the notion is that it's its own unique challenge now when it comes to the normal human development path, that the young adults now are really, really struggling with trying to find a sense of how do I get rid of this debt? How am I going to start a family when I can't even kind of figure out how to get enough money together for rent and take care of myself? I just moved out of my parents' home, and these things are happening in large numbers, and it's putting our generation, the parents of these young adults that are coming out, in a very unique pickle, because in most cases, like in my case, I have children that are in college and coming out of college, and I have adult parents who are now moving into assisted living facilities. And so on two ends, I'm being squeezed, and I think I'm probably speaking to a lot of folks in the audience right now who feels that squeeze of launching your young adult, but then also taking care of mom, and trying to make the whole thing work while still maintaining your job. I mean, this is a very stressful proposition for many of us. Now, the slide that I showed earlier about looking at the different generations, this bolus of this wave, if you will, of Gen Z and millennials, I'm going to highlight that even further here and taking a look at this particular chart that I have, this table that I have on the screen. If you look at like millennials and Gen Z, these kids that were born after 1980, they constitute 60% of our country's population, and proportionately, that will be the percentage of our workforce and our colleges. So this is going to be who we'll be seeing in our classrooms and in our workplaces. And in this one particular line here, I have this sort of highlighting a couple of life-defining events. Millennials looking at the rise of social media, 9/11, the Gulf Wars. And contrast that with my generation, the Gen Xers. I remember when there was a Soviet Union. I I remember the introduction of desktop computers. And so there was a bit of a gap between the millennials and my generation, at least in terms of savvy around computers and sort of global events happening around us. If you look at like what my younger children are, and these are the kids that are born after 2000, the young adults that are currently in high schools and in colleges, they grew up in the age of COVID, and the rise of artificial intelligence and the metaverse. Just getting my brain wrapped around the fact that my 14-year-old spent almost his entire high school and middle school life from a computer screen at home, and wasn't interacting with his classmates for a good 2.5 years. And all the social nuances and training and social graces that would happen during all that time, especially in that high school period, proms, football games, school dances, all those things were not happening for Stephen. And I think about too the introduction of these Oculus eyewear for virtual reality and artificial intelligences helping to sort of pick out things for them when they want to buy something, or what they look at on Instagram. These are all things that have occurred in the last couple of decades. That is very much a part of their normal world. But for us, for the older generation, this is all very, very new. But for them, for these younger folks, it's all they know. Now, I put a big boom there because combine the idea that you've been separated from your peers, a physical disconnection with humans for 2 or 3 years. You then substitute that with an artificially created world through virtual goggles in a metaverse that only exists in the ether. And this is what a lot of our children are spending a considerable amount of time occupying themselves with, and think about the implications of that when trying to introduce them into a social interactive world. So when I think about that, you start looking at how these types of experiences and influences might impact their attitudes towards work. So I highlighted here just that very point. When you look at in this particular chart here, put together by folks over at the Midshipman Development Center for me, we were talking about how with this current set of college students that are at the academy now, a lot of them were actually raised by their grandparents or caretakers, like aunts or other folks. They had a very heavy social media dose throughout their high school years and coming into college. Their parents were teleworkers for the most part in the latter part of their high school years, and how that might potentially affect their attitudes towards work and leadership preferences. Everything when you're talking about work attitude, I want to work out of home. Why do I need to drive into work? Why do I need to drive to class? Explain to me why there's this timetable. Why can't I turn it in when I'm done with it? All these questions I often hear from my students, and a lot of that really raises for me this question of, are we now beginning to see this shift, this generational shift in the expectation sets of not only students, but also early career professionals? Another phenomenon that's coming along is the preference towards coaching as opposed to mentoring or being didactic in our style of teaching. They prefer being coached through some of this material. Now, I put these two images on here about the digital natives versus the digital immigrants. I think of like the Gen Zers, my children, the younger children's generation, and the kids that are currently in college as being digital natives, whereas my generation, the Gen Xers, are probably new to the scene and are more like digital immigrants. Now, this was something that was brought to my attention by a friend of mine who's the provost, vice provost rather, at the University of Tennessee, and what he noticed about his graduate students and a lot of his doctoral programs there was that his students were giving him the feedback that it used to be where be professional, then get personal was the attitude that Frank Cuevas, my friend, and I kind of grew up with. Be professional, be collegial, but get your work done on time, get your professor's projects done on time, and then if you do a good job, we'll get personal. But now, according to Frank and what he's observing, no, do the personal work first, then you'll get professional work from me. In other words, the old idea was that the old process was do professional grade, reliable and timely work, on a consistent basis, then you can get to know me on a personal level, if at all. But now it seems to be on campuses, the new process being get to know me as a person first, then I'll provide you with good, reliable, and timely work more consistently. And that's a big shift. Another thing and this is from my son, Steve, I got this quote from him. When adults try to like train or teach children about things like, for example, mental health, they kind of do the old style of bring them to an auditorium or a gymnasium, give them some kind of presentation, talk about what might come up as questions, and if there aren't any questions, dismiss you for the day. And so they, in his middle school, they're still kind of doing that, but his sense of it is that they seem like they're checking the box, and many of the kids in the gymnasium are on their phones anyway, not paying attention to what's going on. Adults don't seem to know how to talk to us about this stuff. They just didn't understand the assignment, according to Stephen. So is this what we're experiencing, a transformation? Is all the adversity we're experiencing sort of an indication of that? And I think yes. One of the things that I sort of fall back to in my understanding of what's going on is looking at the stress model. And the idea on the stress model is that as you go from levels of calmness up to high levels of stress, okay, on one particular plane, and then you go from weak to high performance, the Yerkes-Dodson curve comes up. The more stress you place on an individual, put a little pressure on them, they tend to perform better and increase their level of engagement in whatever activity that they're being tasked with, up to a point of optimal performance. But then when you go beyond that particular point, as you increase the stress levels, you see a rapid decrease in performance, and you'll have basically burnout where the person is failing. And so this idea of high stress being bad, but low stress can also be bad, is what you're seeing on the screen here. Because if you look at this other end of the spectrum, rusting out, if you're not being challenged, if everything is relatively managed but not challenging in any way, you'll get weaker performance. And in that particular phenomenon, in psychology, we refer to it as rusting out. People that are bored, they feel underwhelmed, they feel underutilized, they feel under-challenged. And that also disengages a person from, whether it's the classroom or from in the workplace. If they're not being utilized properly, or they're not understood, and so they're under tasked, then they rust out. On the other end of that, many folks are operating well above their capacities and they're burning out. So we're seeing the fallout coming on both ends of the spectrum here. Now, how do we know when people might be showing signs of this? Now, the frontal cortex is the part of us that kicks into gear when we're coping and doing a good job of it. But this part here, highlighted in these two little walnut-sized structures in the brain, this is the amygdala. This is activated when we're feeling overwhelmed and stressed. Now, when we're experiencing overwhelm and stress, this is what you see here in this reacting description here. All these different characteristics are how being overwhelmed might look like in the workplace or in the classroom. Difficulties concentrating, trouble sleeping, maybe even increased use of alcohol, obviously a decreased performance and function. But the same thing can be seen when you have a person that's underutilized, they're bored, they're apathetic, they're unmotivated, they're unproductive, they're not contributing. And so having this idea that under-challenged and overworked people are something to target in our workplace, what is it that they're experiencing? What is it that they need? Now, at the Naval Academy, we are actually tracking some of these indications, and these are some of the things that we're using, and we produce what are called dashboards. And this is just a sort of an example of what might look like. As you can see on this chart here, our superintendent can kind of look at things like how many midshipmen are seeking mental health services at any given month. We even have breakdowns about what kind of mental health conditions are they presenting with, as you can see here. So our institution's trying to get a pulse of the mental health of their students by regularly doing these pulse checks and tracking some of these indicators, in this case, looking at like alcohol-related incidents as sort of outcome measures as to how well they're doing with regards to their interventions. And those interventions typically involve peer engagement, getting faculty to mentor or coach some of the midshipmen who might be struggling, getting the faculty involved in that effort, getting their classmates involved in that effort. getting the coaches on the various varsity teams involved in this overall effort. So at the academy, we're tracking that, and we're seeing whether or not that has any impact. And one of the things that I wanted to sort of highlight with this particular graphic here is we implemented this a couple of years ago, but it was right as COVID was hitting. And as you can see, the number of new clients, new patients that were coming into our counseling centers were actually lower in the last several months of 2021, which is when we were tracking this, than in previous years. In other words, the midshipmen seem to be doing okay. And why is that? And it might very well be because of these engaged faculty, the engaged peers. We do resiliency training workshops during their lunch breaks. There's a number of things that we provide to the students at various levels, not just through our counseling centers. And so perhaps those might have mitigating effects, at least at our institution. And as you can see here, this particular trend line shows it going down. Again, you would expect this thing to pop up, but because of perhaps the fact that we've had these things in place, we were able to kind of keep a little bit of a lid on what would otherwise be a sort of a bubbling over of mental health needs in our institution here at the Naval Academy. Now, I had this natural break. Are there any questions or just some thoughts before I continue?
Yeah, so Eric, there were a couple of comments that streamed in, and if you want to raise your hand, I'll get to you in a second. A couple of thoughts that from this last section that curious on your input. One is I'm Gen X and feel that what you were describing about the sort of that from the video, that sort of the growth challenges and everything for the millennials, Gen Z. Upon graduating from the universities is pretty much what they experience. So why is it viewed that it's actually tougher for these generations, since some of it's just sort of a normal, that's the progress in life kind of issue? Yeah. What are the factors that you view that's making it tougher?
That's an excellent question, because after the break here with the questions, that's exactly what I'm going into.
Okay.
So
I'm
not ready to talk about that.
So two other ones that came up. One person commented, they were looking at your deepest fears, were low battery for Gen Z, and they said it feels that there should be general dread around climate change and polarized politics and mass shootings. I mean, that these should be the deepest fears for millennials and Gen Zs. And do you see that those kinds of topics come up when you're talking with the students, for instance, or have they compartmentalized those kinds of issues?
Yeah, that's a great question. So thinking about the idea that broader issues like polarization in our politics or global warming, those kinds of things aren't typically brought up as sources of angst for at least the students that I've come across, both here and at the University of Maryland, where I also do some teaching. It doesn't seem to be the pervasive concern for those folks. What seems to be working on their minds is going to be what I'm talking about next. This sense of disconnection that they're struggling with things that are happening for them in their own lives, but that they feel like they can't approach anyone to talk about it, or that a lot of people are talking about it in a way that makes it uncomfortable, like using social platforms to post what's going on for them, and then getting ridiculed about it, or trying to engage people through some of these social platforms, which is the predominant way a lot of the students nowadays interact. You can have a kid sitting in your classroom, well, not typically at the Naval Academy, but they can be sitting in front of you, and they have simultaneous conversations going on with multiple people around them, and they just don't seem to have the attention span to kind of focus on what they're doing in the moment. They seem to be pulled in multiple directions all at once. And how do you curate that? All these sources of inputs. You have friends over here that are having relationship problems, friends over here that are struggling with whether or not they want to continue with school or be here. You have other people that are struggling with matters having to do with their own health, and so they're wrapped in their own insular world, and that the echo chamber inside that world doesn't seem to contain thoughts regarding the future of the political parties, or American democracy, Jeffersonian democracy. It doesn't seem to be what is typically encountered when I see kids in counseling. Even it tends to be relationship problems. They feel disengaged. They don't know how to talk to friends. They don't have the social skills, the communication skills to articulate how they're feeling. I don't know if you've noticed this, but many of these kids, they don't even use full words. They have acronyms for everything, or they have sort of phrases that gets at complex emotions, like or use emojis to communicate their feelings. But when you're actually sitting and talking with somebody, if you can't use an emoji or if you can't use your acronym, how do you communicate with somebody, about internal experiences? Those are some of the things that I'm seeing. I'm doing a lot of social skills training.
And just one last one for this break. Person indicated that you didn't really discuss the whole issue of helicopter parenting. And do you feel that this kind of micromanagement has had an impact as well, especially obviously in this transition into adulthood?
Yes, I think that's part of it. And when I discuss, this idea of quiet quitting in just a bit here, I think helicopter parenting and the broader topic of failed parental strategies is appropriate, maybe bring up now. This idea that it might even be a reaction to perhaps the sort of the authoritarian style of parenting that was probably very pervasive, in the 50s and 60s, where parents, hey, if you didn't win the, if you're not in first, you're last. Those kinds of achievement and meritocracy oriented type parenting where you reward the people for winning, and if you didn't win the tournament, you don't get a trophy. And as a reaction to that, my generation seemingly wants everybody to feel like they were involved and participated. You came in 18th place at the track meet. Here's your trophy. It does two things. One, it cheapens the person who came in first because everybody gets an award. But the person who got a trophy for being, falling in 18th, now feels like he can be ridiculed for that, and it actually makes him feel even worse about himself. And why is that? Well, because parents seemingly want to protect their children from negativity, when in fact what needs to happen is an inoculation to that by being exposed to it and coming up with healthy strategies for doing so. One of the other byproducts of helicopter parenting is a child is supposed to, in your adolescent years, cleave from your parents and unto your peer group. That's the big challenge in adolescence and early adulthood. You become less reliant upon parents, and you become more reliant on peers and people outside of your family. The prolonged living in your parents' house after you graduate shelters them and keeps them from having to meet people outside of the family and deal with how do you deal with a roommate who doesn't do the dishes? How do you talk to a person that you're interested in? Helicopter parenting and even the use of social media apps like Tinder and some of these other sort of surrogates for developing social skills are grossly absent in a lot of our younger people. Or the things that are available on the internet, there's so much of it and no one's curating it that they're just overwhelmed by information or just get bad information. So I would say both maybe helicopter parenting and maybe parenting through the internet has been contributing a lot to this sense of sort of social ineptitude or inadequacy.
Great.
Yeah.
So that's what we have for the moment.
Now, connection is that to that point, this idea of being disconnected, maybe because of your parents in some ways, made sure that you were protected, that didn't want you to be exposed to negative things. What you learn as a adolescent and young adult is that in order to survive some of the trials and tribulations of life, you need to reach out to people. You need to go to your social support networks, whether that's at your church, or you go to the YMCA, or wherever if you have a sports program that you're involved in, or a league, bowling league, or something like that. Connection is how people humans instinctually survive and deal with stressors in the environment. Connection. And when we looked at this at Department of Defense, these three factors, thwarted belongingness, perceived burdensomeness, and capacity for suicide, capability for suicide, were the three big factors that seem to indicate the loss of connection. So when you look at like on this graph, this is something from interpersonal theory that we use in the Department of Defense. Thwarted belongingness, feeling like you're alone, you don't have anybody in the world to connect to. As that increases, and then you pair that with perceived burdensomeness, you're becoming more of a burden to other people. And if you have access to lethal means, if these three factors and the Venn diagram overlaps more and more, this shaded area here, as this area increases, the desire for suicide increases. And so if you push this thwarted belongingness, this idea of being disconnected further and further into the Venn diagram overlap, you now have a growing population of people who are thinking about suicide. And it is this factor right here, this idea of not feeling connected, not feeling that they belong to anything, is really, really pervasive out there. And it's further fueled by the fact that on with social media platforms, that even though you're connected with hundreds of friends or thousands of friends, you're not physically actually in their spaces. You're not deriving the interpersonal connection that you might get if you're sitting in the same room with someone. So even though they're connected through the internet, they're more and more feeling a sense of being alone and disconnected. This picture right here is an MRI shot of places in the brain where oxytocin, which is that hormone that gets released when you feel love for somebody, that warm and fuzzy feeling, that you get when grandma makes your favorite meal, or when you're snuggling with your wife or your children, around on a warm bed, and on a cold night. Those kinds of fuzzy, very positive feelings are tied to oxytocin release. And so these sites in the brains is where it's released. So this picture this is a picture of love. And you only really get oxytocin relief with physical connection with people. Physical connection with people. Now think about that for a second. I showed in that previous slide, more and more kids are connecting with their peers through the internet. And more kids are connecting with people through these virtual reality goggles that puts you in the metaverse. So you're in the same room with somebody in this metaverse type world, but you're physically not in the same room with them. Is there the same level of connection with a person when they're not physically in the same room with you? And I postulate that the answer is no. That there's less of an oxytocin release when you're dealing in virtual platforms, or when you're dealing with social media platforms. They're not the same in terms of the release of oxytocin as you would find if you're in the same room with people, doing work with them or enjoying their company. That physical connection with people is what releases oxytocin, and I postulate that there's less and less of that going on, and a lot of this resistance to change may come in the form of quiet quitting. Millennials, this is the knock on them, and Gen Zers, they're entitled, hard to manage, and lazy. But really, and I alluded to some of this stuff, is they really want to be impactful in the workplace, and they want to make an immediate impact in the workplace and find purpose in what they're doing, but they don't have enough time, in the workplace, or enough time, in school, to be able to work their way to those kinds of achievements. And part of that is because of, in some ways, failed parenting strategies, this helicopter parenting, the rise of technology, specifically, the social media platforms and these AI and these virtual reality goggle interfaces, growing impatience. I mean, if you think about it, everything is instant. If I want something, I just order it on Amazon or DoorDash, and it's there the next day. If I want to date somebody, I don't even have to learn how to talk to a person. All I have to do is swipe left and swipe right and have a pretty nice looking profile. And there, bam, I have a date Saturday. So that instant gratification that's facilitated by technology is growing, is sort of leading to more impatient young adults. And then the environment, and this is where I think our generation kind of plays a role. In the work environment or in the classroom environment, we've rewarded so much worth on meritocracy. You perform, and when you perform, then we promote you. And when we promote you, that's just an indication that we like how you're performing. Well, if you couple that with kids that are coming through now, who they everything that they've been given in life in some ways has been almost instantaneous. If they want to know, how large is a blue whale or what the Krebs cycle, they just have to Google it. Having to sit through a 45-minute lecture or a 2-hour lecture 3 times a week for 12 weeks seems like a waste of time for a lot of folks. But that's the institution that we're sending our children through in colleges. In the workplace, having these young professionals coming in, and they want to have the C-suite type jobs and make an impact in the agency or in the lab, but they haven't put in the chops and the time in to be able to earn those types of things. And so what you end up seeing here, and I have this depicted here, is that this generation wants respect, but they don't realize between the mountain between them and achieving respect, there's a whole mountain in between. And I don't care if they run, sprint, or crawl, you still have to get up this mountain. And this whole part right here has been taken out to some degree by technology and this instantaneous kind of gratification that a lot of these younger folks are experiencing in their day-to-day lives. Couple that with this social disconnection, potentially because of COVID, the social isolation, the social distancing policy, you have an increasingly disconnected population who don't know how to talk to each other or engage in each other socially, who would like to have immediate impact, but haven't gone through the work required to be able to earn the kind of respect that they're seeking. And if you think about like dopamine being present not only in products like alcohol or gambling or smoking, which you get dopamine release, which is a pleasurable sort of a soothing kind of experience when you have dopamine release. Social media also releases dopamine. So in a weird way, here you are telling these young adults, hey, you've got all these stressors happening to you in life, you know, and if adult life gets you down a little bit or gets a little rough for you, here, have a little hit of dopamine. Go log on to your social media accounts and see, you know, how many friends are following you, or see what people think about your latest post. In other words, you know, access to social media platforms, those aren't regulated. We don't have a way of sort of titrating, filtering, curating the kinds of exposure that our children have to these social media platforms, and forcing them in a way to move away from the computer, put away the phone. If you're at dinner with the folks and the person that you're talking to isn't present because you're talking to them on the phone, put your phone away. Part of that is tied to this sort of training over the last 10 years or so of children learning that, if I'm bored, just turn on my phone and swipe. Start looking on the internet and solving some of these cravings through just Googling it or sending out a Snapchat message. All these things are playing itself out. And the last thing I want to kind of put out there is that it might very well be that we are seeing a tension between two types of games. I'm using gaming theory for a second here. That when you look at like a game like baseball, there's fixed rules. There's a fixed time frame that everything happens in, and everybody agrees to the rules and everybody agrees to the time frame. So a baseball game is over at the end of the 9th inning. But when you compare that to an infinite game, and game theorists out there, if you can track this, the infinite game is something like the Cold War, where it's not about winning. There's no winning involved in this game. You're competing, and you're competing against an adversary, but the game is ongoing, and there is no final inning. There is no ultimate champion. The way you win at this particular infinite game, in the case of the Cold War, is you have to outlast your opponents. And what I think is happening with many of our young adults that are coming through is that they are dealing almost in an infinite game type mentality. They don't see the need to have finite deadlines or finite type goals. They see it as an ongoing process that's constantly sort of building upon each other, and they're being forced in a way to go into a workforce or go into institutions like colleges and universities in a way where they're being in a way forced to kind of play by fixed rules with fixed timelines made by adults who made the rules and made the timelines without their input. And that brings us to kind of this idea of what do we do next? And again, there's several books out there. One, a great one is Transitions, where they talks about making sense of these life changes that are going on. I'm going to sort of scooch through this because the idea is that in this particular graph here, what Dr. Williams is talking about is that right now, when you're going through this sort of time of turbulence and transition, this is where new ideas start coming out, and eventually it settles, and these new ideas begin to take hold, and you'll see greater hope and enthusiasm and more productivity. So what is coming out of this transition? What I think is kind of coming out of this transition is ultimately something along these lines, that when you look at like students in the colleges and campuses, and you look at the young professionals in our institutions, they're looking for guidance. They're looking for people to engage them more than perhaps in the past, more than, hey, here's your assignment, here's your project, it's due on Thursday, but rather having a relationship with your instructor. And I don't mean relationships in a negative or an unethical way, but getting to know your student, getting to know your professors is what they're craving. Why? Because they haven't had a whole lot of exposure to people outside of their parental group who got to know them as an individual and got to know the mentor or the instructor or the professor or the boss in a more personal way, and gaining that trust that perhaps they weren't able to establish because of all of the things that they were dealt with, the hand that they were dealt with during the COVID years, where you didn't have a chance to relate with people, you didn't get a chance to sort of practice good communication skills, you didn't get to talk to people one-on-one and get that physical interaction with them. They're now, it's almost like a delayed process. They're now looking for that, but now it's happening later in life. Now, I'm going to, just sort of allude to this idea here too, this idea of emotional intelligence. I do a lot of workshops on emotional intelligence, and I think that's something that we're offering here at the Naval Academy to our faculty, and also to a lot of our scientists that are engaged in research here, so that they can have a better understanding of what emotional intelligence is, and how they can apply some of the skills from emotional intelligence literature that we've come to know over the years in managing relationships better. And in a nutshell, basically boils down, understand your own emotional functioning and managing it so that you can be aware of other people's emotional functioning. And when you get to understand other people's emotional functioning and what situations they thrive in, then you can manage them better. But you have to first know yourself before you can start sort of shaping others and understanding others. And I have a whole nother talk on this particular topic. So with that being said, I wanted to kind of have this last thought. As a parent leader and a leader here at the Academy, I promise you that if you send your children to this school, or if I'm in some capacity later in life and it's the leader in their agency or their institution, I will promise you that if your kid as a young professional comes under my tutelage, under my supervision, I will treat them in a way that will help to sort of foster their professional and personal development by getting to know them. And it's my hope that you see me taking care of your kid, that approach to seeing your child develop and continue to grow is exactly what you're doing if my kid were at your institution. And I pose this particular quote to a lot of my colleagues here and say, you hope that a lot of your colleagues, the professors, the supervisors are taking care of the needs of their students or the people in their charge in the same way. I will promise that if they are somebody who's going to be working for me or under my supervision in some way, that I will treat them the same. And I think if we all begin to sort of see each other as being part of this larger effort to reconnect with each other, and I think that's going to be something that's going to go a long way in helping to curb this crisis. So in summary, as you return back to your settings, know that interactions in this new world of learning and work transformation can be emotionally challenging, and that there's a mental health crisis going on, and you're on the front lines. So engage, know what this looks like for your institution. Have meaningful relationships with your students, establish a sense of, help them to establish a sense of control when facing emotional turbulence. Reach out to them. You're the first responders, as was alluded to earlier with the procedures, get them in, hooked into your resources. And remember that adversity is transformational. Stress is not necessarily all bad. And that if you connect, it does help to protect individuals, balancing their resistance points, engaging in emotionally intelligent interactions with these folks can help them get their needs met. And with that, I'll take if there's any questions remaining or thoughts.
Absolutely. Thank you very much, Eric. Yeah, so a whole bunch of questions been flowing through the chat. Hopefully you have a chance to, look at it.
Oh yeah, I'm gonna pop off the share here.
A little bit. Yeah, and I'll go ahead and share over into ours. So one of the things that was asked by a lot of folks, what is it specifically that they can do? I think one of the concerns is whether as a parent, or a faculty member, one of the problems is giving the wrong kind of help could be actually more harmful. And what kind of trainings and things like that would this really require? What are your suggestions? What should they be doing as a faculty member as a dean, department chair, or what have you, to help
Yeah.
their students and the like. I mean,
Well, at an individual one-on-one level, obviously, if there are students coming to you, personally or directly, obviously setting aside some time, if it's even possible, to work with that individual student or that particular young professional. But as an institutional level, if you are a department head or a director, or a provost, what I've oftentimes said is like, are you engaging your students? Are you engaging your faculty? What policies or what programs do you have where maybe you provide, let's say, your faculty members some what we call them coaching skills, and oftentimes these are 4-hour type set aside training periods where we teach the faculty how to ask and how to engage sort of probing questions, trying to get an understanding, why a particular student is struggling or what's going on. In other words, teaching some basic skills, almost like CPR, at a basic level, to faculty, to frontline faculty, and then having those faculty members then provide sort of like frontline intervention when they do engage little Johnny in class, look like he's struggling. Setting aside some extra instruction time instead of reviewing necessarily, the Krebs cycle. Hey, what's going on for you that might be getting in the way of you turning in your homework assignments on time? I know a lot of times, having 20 or 30 faculty members doing that at their level can reach hundreds of students, and then having those faculty members that are trained in that have a sort of regular touch base, whether it's through some kind of listserv or chat, where they're sharing ideas and thoughts that they're engaging or that they're encountering in their classes, and sharing best practices within their department. As a director or a division head or something like that, do you have something like that where you're engaging your faculty, giving them some of the basic skill sets that's offered? And I have a lot of suggestions for that. I can leave that with Chris later too, about sort of short training programs to help faculty members learn particular sort of interviewing skills or conversation, fierce conversations you can have is what we call them here with our students, to sort of get them at their level when they encounter them. When you go higher up than that, let's say at the college level or a particular service level, how are you tracking what's going on around your various work centers or cost centers? Are you able to identify, because there's like, some institutions, people are doing fine, they have no idea what you're talking about. Everybody's fine over here, and then within the same large organization, then other places might be having some difficulties. How do you even know that that's even happening at your agency or institution or at your university? Do you have a way of tracking that so that you can kind of strategically allocate your resources and target, let's say, for example, that division or that college or that particular workplace with some of your high value resources, your counselors, your social workers, if you have those kinds of like EAP types, and target them to areas and places that might be showing the most need and concern? Do you even have a mechanism for knowing if that's going on? So, at the individual level, at the sort of the moderate, institutional level, and at a broad institutional level, what are your policies and procedures to engage your people and get to know the individuals at their level, and keeping it as local as possible? Have the people who are dealing with the problem most closely be the ones that are the most sort of have the access to the most amount of available trainings, like, for example, the fierce conversations and the warrior toughness type training that we have for our faculty here, and I can share that with you later, and train up on that so that they can have their faculty provide that at their level for their students. That's a lot of words.
Yeah, no, it's good. So I think this is also gets to, there was one person who is working in counseling has a very interesting comment, where the biggest challenge as they are, just like you, encountering more and more issues and trying to find more supports for these students that need, for their mental health, and the accommodations and the other changes and supports that are needed, that the institution momentum, shall we say, is it finds it as an inconvenience
Yeah.
and inhibits whatever their other mission is.
Yeah.
And so it's interesting because you're saying, the touch point is down at the grassroots, where you're dealing with the students, but how do you convince the people up top that this is important?
Yeah. All right. So this gets at kind of like a values question. You know, as I think as a byproduct of our socialization, in the military, for example, it's mission and then morale. So yes, you need to take into account your people's needs, but you still, at the end of the day, have to accomplish the mission. So if a person thinks of it like that, then okay, are you engaging your assets to meet the needs of your mission? Let's say, for example, you have to produce some kind of results from your research project so they can understand what to do with this larger problem that's being dealt with at the governmental level. Okay, so that those things have to happen, but if I have to divert my attention to my people and allocate these resources to my people, that sends a message. It sends a message throughout the organization that your people are less important than the mission. I know that sounds weird to say, but I've seen this happen in other institutions where they might, let's say, lay off some folks because they had to make some budgetary decisions. And the day after they laid off their people, it sent a loud and clear message that, okay, at any given time, we can do without you, and still make mission, because we have to cut you from our books, so that we can meet mission. Let's say, make money for the company, or be able to sort of streamline our organization so that we could focus more on smaller things. Your people, at some point, if you invest in them, they will yield something much greater than perhaps adding more people. If you can get the most out of your people when you have them. And how do you do that? You have to see where they're at. What are some of the things that might be inhibiting why that project isn't being turned in on time? I'm sort of suggesting to you now that you're probably going to see more and more of this happening. We're seeing it happening here. People taking year-long or month-long leaves of absences because of mental health. They need a mental health month, or if they don't get that, they quit. And so what happens when that starts to occur? Mission obviously will be impacted by that. So there's a balance. And again, I don't know what particular situation the questioner has, but I bet something along the lines of that there's a balance not being struck between getting things turned in when they're needing to be turned in, and getting the product moved, and the morale of their people, or the willingness or the motivation levels of their people to perform, to hit those task marks, or those particular milestones, whatever those are.
Excellent. So I trying to be respectful of folks' time. I got one last question that came in. See if you have a comment. So the take is, I'll say, a different angle on the helicopter parent. Person is talking about students that they have who are very self-aware. They're really with it. They're very motivated on their academic and professional goals, but their parents are holding the purse strings and putting their thumb. Their vision and alignment and the expectations of the student are different, and there is obviously a lot of duress over this difference. And how does that, is there a tactic to address that and to support the student?
Yeah, well, I don't know if this is a private institution or not. I mean, I know I see that a lot in private institutions where the funding becomes almost like a leverage point. I mean, that's an individual, that might be an individual specific type thing, but my broad response to that is, when a child or an adult child has a parent who is helicoptering them and in many ways enabling them to continue this protracted adolescence, they're ultimately doing a disservice to the child. I know that for us here, when we have an issue with a student, we do have our medical department and our counselors reach out to the families, and try to explain to them what's going on and what the consequences are if this, if this particular problem, let's say they're failing, or they engage in some kind of behavior problem that's disruptive to the institution, that if the parents aren't involved in that conversation, then we're only dealing with half the problem. We're dealing with whatever the kid presents. But when we engage the parents, and we see those kinds of dynamics going on, sometimes it's not even the person. There is a dysfunctional family that this kid's coming from. That allows us to at least see into like what's going on, what are some of the influences in this particular case, and maybe help facilitate through our, we have social workers to help facilitate maybe some kind of family, liaison or engager who can help sort of settle what some of those concerns are with that particular family. We do that through our Midshipman Development Center. It's actually a part of our agency's work to help sort of like communicate with families. I know a lot of other universities may have something similar to that through their counseling departments. But as far as like, will parents know when to let go of their children and recognize when they're actually hindering them? It may take a parent sort of watching or seeing their child fail and be able to be okay with it, and then allowing their child to kind of recover from that failure, and see that they're going to be okay. Ultimately is how to break that parent from that need to kind of helicopter them. That's the only real way to kind of like break them from that, is to sort of see that their child is fine and they can actually solve their own problems without them. But unless there's some sort of family intervention at that individual family level, I don't know how else to break that parent of that habit. And if the institution has a policy for that, like ours does, we have an entire agency dedicated to that kind of stuff, then I don't know how to do that at a broader scale, other than to create sort of an aspect of the institution that helps to bridge gaps between families and employees, or families and students, and recognize and identify resources that family might need to help the student kind of perform better and graduate.
Great, thank you. So Pranoti, did you want to help us wrap up?
Yep, sure. Thanks. So thanks very much, Eric, for a very engaging presentation. I know there are lots of questions that came in.
There are a lot.
Hopefully, some of the resources that have been posted in the chat and things that you alluded to will, people will find them useful. So I wanted to thank everyone for attending. And again, the recording will become available in a week or so. Please do connect with us if you have additional questions, and maybe we can get them to Eric, and maybe he'll be willing to answer any additional questions that didn't get answered. If you are a department chair or a leader on your campus who would like to join the AGU Heads and Chairs community, please do reach out to me. And Chris, if you could go to the last slide, I want to invite you to the next webinar that is taking place in the month of March. And we're going to be talking about how you might consider working with communities to do research together. So I hope to see you then. Thank you very much, and have a great weekend, everybody.